Welcome to alzheimersmd.org. Why did your loved one have a dramatically decline in their Alzheimer's disease, and what should you do? Hi, I'm William A. Van Horn, MD. I'm a medical doctor who specializes in all levels of memory loss, including advanced Alzheimer's disease. I'm a geriatric neuropsychiatrist, and I've been treating people and helping people for over 20 years. What should you do if your family member dramatically changes? First, understand that's not caused by Alzheimer's. As we get older and patients with Alzheimer's do have fragile brains, our brain density, our cells in our brain are less dense, our brain is more susceptible to stress, but Alzheimer's doesn't have dramatic changes. So when someone tells me that, that tells me something else is going on, which in most cases is reversible. So if you have someone who in December was doing well, like a lady that I talked to recently, and in February is on the deathbed, that wasn't caused by Alzheimer's. That was caused by something else. The most common cause is what we call a delirium. A delirium is when all of a sudden the brain gets drunk, a person gets very confused, their functioning drops dramatically, and oftentimes they'll hallucinate, be paranoid, and won't get out of bed. A delirium is usually caused by some medical problem that is reversible. I recently did consults in upstate New York, and I saw hundreds of deliriums. I told the family members that I expected their loved one to return to close to the baseline that they were before they had that sudden drop. When a delirium is missed and a person is said to be advanced Alzheimer's, which I've seen too, oftentimes the family will decide it's time for them to die when in fact they may have several years of life ahead of them. The most common cause of delirium is a bladder infection. Almost 2/3 of people who have delirium is a bladder infection, particularly in women, but also in men. But it can also be a viral infection of the lungs. It can be just an upper respiratory infection. It can be a change in some kind of stress in the environment, just a change in location. Being moved to another place causes your brain to go into a delirium. The critical thing is to get a thorough medical workup and don't accept that they can't get back close to where they were before you saw the dramatic change. Maybe the most important point I can make is a dramatic change is not their Alzheimer's disease. It's something else, and you need an expert to know how to figure out what it is and fix it. Thank you for joining me on alzheimersmd.org, the place where you learn how to prevent Alzheimer's disease, slow down memory loss, and help a loved one with advanced Alzheimer's. We have an exciting new guide that summarizes my approach, my medical approach to Alzheimer's disease, showing what medications are bad for your brain, that accelerate memory loss, showing medicines what are good for your brain. Download it now.